Um, Insurance in the cancer journey. So I have to say that I get really energized when I come and I watch our physicians and our researchers, and we talk about the cutting edge of technology for cancer care and either making cancer chronic or curing cancer, developing new cures, integrative medicine, all of these wonderful things. And then I get to think about how behind our insurance reimbursements are for all these cutting edge therapies, whether it's the genomics part of cancer where we're actually doing personalized medicine to target your individual genome, whether it's coverage for yoga, massage, these things. And so just know that we're aware of it. And one of my pleas through this entire presentation is patient action or family action. And so I think oftentimes our patients and our families feel victim to their insurance companies and don't feel like the insurance companies consider them their customers. And in many cases, that's true. But we need to figure out how to work together as a team to take more action on behalf of our patients and our family members. And your voices need to be heard. And so I think oftentimes they're not heard enough, and we don't solicit that support enough as a global healthcare community. So I'm just going to go through some of the common terminologies. What's a premium? A premium is the amount you pay every month or every quarter or every year to maintain your insurance coverage. And I don't know about you, but every year my premium goes up for the amount of insurance that I feel is sufficient for my family. And so one of the things we often get into trouble with as a healthcare community is shopping for the lower premium plans. Those often come as to an expense later on in the journey, and I'll talk about that. And oftentimes those hit in annual deductibles. So oftentimes we get a lower premium plan with a higher deductible, thinking it's okay, I can afford that $5,000 when it hits. I'm healthy now. What's $10,000? I'm going to play the deductible game, and oftentimes that gets us into trouble because when it does hit, it's always multifactorial, right? So it's never doesn't hit at a good time, whether it's a surgery that you didn't anticipate needing, whether it's cancer, whatever. It's always life happens, right? So and a lot of us either don't have the ability or the discipline to keep that $5,000 in the savings account to pay for the deductible. And so in the past we talked a lot about uninsured populations of patients. Today it's around underinsured. And it's not that the patients don't have the proper amount of insurance, they don't have the proper amount of financial wherewithal to cover the deductibles. So then they get into trouble on that. And so and believe me, we're all subject to this moment. So it becomes the monthly cash flow dynamic versus the lifelong insurance dynamic. So the deductible is the amount you pay before your insurance company will start contributing to the cost of your care. And these plans are extremely complicated. So sometimes your deductible kicks in on major events. Sometimes the deductible is on regular events, such as visits to your GP, your family practice doctor, your internist. Sometimes that it doesn't apply to the deductible. So this is complicated stuff. So the copay is the amount you pay for your office visits. So depending on your facility, you could have a copay responsibility and or a coinsurance responsibility. So the coinsurance is a percentage of the visit you're paying for even after your deductible is met. So a lot of facilities have coinsurance, and then your out-of-pocket maximum is the amount you're required to pay. And so once you reach your out-of-pocket maximum, which is in many cases quite high, so you may have a deductible of $5,000, but you may have an out-of-pocket maximum of $25,000 to $50,000. So between your deductible, your coinsurance, your copays, that all adds up to be your out-of-pocket maximum, and then your insurance starts to kick in for 100%. And Medicare is complicated. It used to be straight Medicare, 80-20. You would have your 80% Medicare coverage, your 20% that you would need to figure out how to cover through a secondary plan. Now Medicare has a bunch of HMOs that have higher deductibles, so it's getting more complicated as we speak. So basically, the other point of the conversation this morning is communication. So I think a lot of times we get into moments as a community and we don't want to talk about our finances in the scope of our care because it's embarrassing, it's troubling, it's personal, and we need to open up those conversations more. We're not doing as good a job here today as we are going to do in the future with that, with providing more financial counseling services to our patients and their family members, because that's an important distinction, or their caregivers or their support systems. And we can do better at that here at Winship and starting those conversations earlier and being more transparent about those conversations. And we are in active process of working on those. Again, it's kind of complicated business. It requires a lot more training. A lot of times our healthcare systems put our people at the front end of these things that have the least amount of training and the least amount of educational background. And so we're working on changing those dynamics and providing more training for our employees. They need to know this stuff in order to help you all through this journey. But we also need you all to help us through this journey and being transparent and communicating about what's going on in your lives. If we don't know what's happening on the front end, it's harder to be proactive about it, and then we're often reactive to it at the back end. And one of my personal missions is that the finances should not get in the way of your care. The finances should not be the thing that drives the stress levels that you need to go into meditation to take down your inflammation levels, right? So, and we need to go with you on that journey, and so that's what we're working on. So there are many things. Life happens, right? So you may stop working. You may have a job change. You may not be able to afford your insurance premium during those changes. So there's COBRA coverage. Well, coverage is very expensive because your employer no longer covers part of your insurance deductible. Notify us when that's happening, and we'll see how we can intervene and help. It's never a guarantee, but it is. We do have the ability to help in different ways, and a sophistication with information that the internet doesn't have. So, and then you may decide to change insurance plans. So every year our insurance plans come up for renewal, and you may decide to change, and you may get called by what I call predatory insurance people who say, oh, it's going to be fine. Your plan's exactly the same. It's going to cost you half the amount of money, and your doctors are going to be the exact same doctors. That is absolutely not true. There is no way that can happen. And so let us know. We can help you investigate your insurance plans and look and query if your same doctors are on the plans, if they have a more narrow network where Winship's not even in the plan anymore. We had a lot of situations where people changed the insurance and were told, you know, Emory's still in your plan, and lo and behold, it's not anymore. And then you're in the middle of your cancer care, and now what do you do? So just communicate is my best advice there. Medicare. You're now Medicare eligible. Notify your team. They can help walk you through the difference between the Medicare HMO plans and the regular standard Medicare plans. Make sure that, again, you understand what's covered under your plan. So some plans cover certain hospitals, some plans don't. Some plans cover certain interventions, some plans don't. Some plans are harder about what they consider research, some aren't. And we kind of know those plans from the insider track, so to speak, because we're subject to the payments of those plans, so we can help describe some of those things. Medicaid and other exchange coverage and assistance outside of the typical health insurance coverage. Let us know. There's oftentimes assistance that we can cue you into that we know about that you may not know about. It's kind of like when you apply to college. My daughter's applying for colleges right now, and there's all kinds of scholarships. Like, I have no idea. Her admissions counselors at her high school are absolutely phenomenal with that. But if we don't communicate about them, they're not going to, if we don't ask about the scholarships, they're not just going to volunteer it. So again, let us know and we can work with you on those things. Your care team. They may not and probably don't have the answers to a lot of their questions, but they're there to help you physically, emotionally, financially, and they're the ones that I often get calls from, or my team gets calls from, to say, hey, I've got this going on with my patient, how can we help? And then we can come in for action. I talk to Raghi quite a bit about those things. And to get you all connected to the right insurance resources or the right coverage help, or we have a very active social worker group that I'll talk about in a moment. They're key to a lot of this work. And then please don't be embarrassed. Again, we're here to help. Life happens. Things happen. If we don't talk about it, then we're going to create problems on the back end. If you've read the news, cancer is the, I think, #1 disease for bankruptcy for patient populations. It's expensive business that we're all in together. And so how can we help on the front end to avoid those things on the back end, and helping with life issues as well. So this isn't just about your care, treating the whole patient, understanding what's going on. How successful are we going to be at helping with you with your disease if you're worried about losing your house or not wanting to get a prescription refilled that's going to help you with your disease if you can't afford it because you have to pay your gas bill. So we have financial counselors and financial navigators that can help looking for eligibility, reviewing billing, and setting up payment plans. Please know that we do have payment plans, and we are here to help. This isn't just a here's this bill and pay it now moment, and we do have financial eligibility criteria for charity care and things of that nature. And then our social workers, transportation, child care, mortgages, gas bills, like I said, prescription assistance. One of the things we're working on is our drug replacement program. So a lot of our pharmaceutical companies have really robust drug replacement programs that we can help provide better assistance with drug and then get that drug replaced and move forward. So lots of things out there, and I understand that we are not as transparent as we need to be in Winship about what's available. So again, ask and we'll help. Social workers help with counseling, recommending support groups. One of the other things we're working on is growing our support groups. So we don't have enough support groups, in my opinion, to serve our cancer community. These are things where you can help each other as well and be assisted with a social worker. Spiritual counseling. We have a brand new spiritual counselor. I'm so excited. Her name's Caroline Peacock. She's going to grow our spiritual health program here at Winship of all denominations. And so really excited for that to take root. And then assisting in transportation needs and referrals for external and internal programs for financial assistance. Some external resources that are available, prescription assistance programs like I spoke about, a lot of copay assistance programs, short-term lodging, mortgage payment deferment, transportation, food and voucher programs, and child care assistance. A lot of these externals require care team intervention to help justify the need for it, and so another reason why to involve the care team in these moments. So. And my main message is you're not alone. Our focus is you, and please reach out and communicate early and often. And with that, any questions? So it's actually the employers. So if you look at how insurance works, your employer purchases insurance on your behalf and pays a premium to cover you. It's actually the employers who can cut out the middleman. So there are a lot of employers that are doing that. Home Depot, in fact, cut out the middleman and subscribed with Cleveland Clinic for their heart care. So that is becoming more common. I think it's an innovative idea to talk about hospitals. I think some of the dynamic is trying to figure out, because it's kind of like going when you like car insurance. So if you wreck your car, your insurance company pays the person to fix the car, and all the car fixers getting together and getting insurance, making their own plan that people would pay into. kind of like that. I don't know that we've figured that out yet. It's a great idea, though. Thank you.